Good afternoon. I'm Joanne Conroy, President and CEO of Dartmouth-Hitchcock and Dartmouth-Hitchcock Health, and welcome to Dartmouth-Hitchcock Manchester. I'm pleased to be here and excited to have all of you here with us and in person to celebrate the realization of this really important project, the completion of the Dartmouth-Hitchcock Manchester Ambulatory Surgery Center and clinical office expansion. It's wonderful to see so many people here, new and familiar faces, our community partners, our neighbors, our patients, friends, colleagues, Joyce Craig, the Mayor of Manchester, along with our local and state legislators and my Dartmouth-Hitchcock Health colleagues. I'd be remiss if I didn't recognize a few guests that are here today. Dartmouth-Hitchcock Health Board of Trustee Chair, Ed Stansfield, who will say a few words shortly. I think we were going to see Dartmouth-Hitchcock board member Roberta Hines and her husband Jerome Leebrand, but I'm not sure they were able to make it today. Is Dartmouth-Hitchcock board member Tom Glynn here yet? Thanks for attending, Tom. Manchester Ward 2 Alderman Will Stewart is here. Thank you. Chad Ambassador, and always the star of the show, Elliot Perry, and his mom and dad. And our colleagues from Catholic Medical Center, John Cronin, who is the chairman of their board, Alex Walker, the president of CMC, and Carol Ann O'Sullivan, senior VP of Provider Network and Integration. I think I saw Jason Cole here, who's their legal counsel. Thank you for coming. I would be remiss if I didn't thank all of our employees who always have the best interests of our patients in mind and who have provided valuable input into the design of this space. To our neighbors for your support of our important work for this community, and to the City of Manchester for giving us the opportunity to provide the best healthcare and wellness services to the residents of this community. And thanks, of course, to all of you for making the time to be here. And finally, there is one person in the audience today without whose commitment to this project would never have happened, Dr. Steve Paris. Steve and I talked about this project, I think, the first time I met. It might have been even before I took the job. He had been working on this since, we think, maybe 2004. When they had multiple phases of design and imagining what we could do with the space here on this campus. You and your team inspired colleagues across the health system, and we're really the heart and soul of this project, and we're very grateful for all you did to bring this vision to reality. Thank you, Steve. Now, what you see here in this building are the fruits of a labor of love and a commitment to create an expanded facility to care for our neighbors in the new paradigm. The people of Manchester and many people beyond Manchester will be able to receive care in this facility, and an environment that optimizes the strength of practice groups embedded and engaged in the community with the added benefit of coordinated top-tier medical expertise of an academic health system. This expanded facility allows us to deliver high-quality, cost-effective ambulatory surgical services right here. And now our patients, their families, and their community members who live in Southern New Hampshire can count on getting excellent, personal, and attentive care within our system. This expansion allows us to deliver advanced medical knowledge and services in a personal and local manner, expanding access to primary care and urgent care visits for both children and adults. It will also enable us to infuse state-of-the-art academic medical care by combining orthopedics, podiatry, spine management, and rheumatology expertise in one comfortable location, making it much simpler for our patients to access comprehensive musculoskeletal care. We are committed to making it easier for residents in Southern New Hampshire to access all the health and wellness services they need close to home. And now I'm pleased to welcome someone who truly knows and cares for this community, the Honorable Joyce Craig, Mayor of the City of Manchester. Mayor Craig has been a key supporter of our efforts, and we're grateful that she could join us today. And she's got a bunch of aldermen that she's keeping on hold back at the City Hall in order to address the group. So, Mayor Craig.
Good afternoon, and it's so great to be with all of you in person on this gorgeous day. And I want to thank Dr. Conroy and everyone at Dartmouth-Hitchcock for inviting me to join you. You know, it seems like just yesterday we were gathered here for the groundbreaking, and now this facility and exceptional staff is ready to ensure the highest quality health services are easier to access for residents across our region. Many of you know the mission of the Manchester Health Department is to improve the health of individuals, families, and the community through disease prevention, health promotion, and protection from environmental threats. In order to be successful in that mission, the city must have effective and robust partnerships with organizations like Dartmouth-Hitchcock, who not only care for patients within their walls and their facilities, but are fully committed to the communities that they serve. Dartmouth-Hitchcock has been and continues to be a valued partner for the City of Manchester, and we rely on them to be innovative and proactive as the needs of our residents evolve. I'm so grateful for the investment that they've made in our community to ensure families have access to the high-quality health care that they deserve. So I want to thank you again, Joanne, and the entire Dartmouth-Hitchcock team. We look forward to a bright future for our families, for our businesses, and for our community. And you are a key player in that. Enjoy your afternoon, and I'd like to turn things back over to Dr. Conroy.
Thank you, Mayor Craig, for those kind words. We're so appreciative of you being here today. Now I'd like to introduce you to someone who's been an invaluable resource to all of us at Dartmouth-Hitchcock Health. His vision and understanding of the complicated landscape of health and healthcare and his dedication to helping us achieve our goals has been critically important to our success. So please welcome Ed Stanfield, Chair of the Dartmouth-Hitchcock Health Board of Trustees.
Thank you, Dr. Conroy, for those kind words. Dartmouth-Hitchcock Health's mission is to advance health through research, education, clinical practice, community partnerships, and this is the hard part, providing each and every person the best care in the right place at the right time, every time. To fulfill our mission, we must be great at what we do, and we must be great community partners because we're in the community too. We're your neighbors, we're your friends. We sit on select boards with you. We watch Little League games together, local theater. The strength of the community is woven deeply into the culture at Dartmouth-Hitchcock Health. And our investment in the southern region is an investment in our collective future and our collective success. Dartmouth-Hitchcock has been here in this location 30 years now. We believe strongly as a health system and as a business, as community partner, that it is our responsibility to fulfill our mission that I just described, to give people the care when they need it, at the time they need it, in the place they need it. The Manchester expansion project and the investment in this community is part of fulfilling that promise, and we could not be more proud. As Mayor Craig had noted, we're all part of the fabric of the communities that we serve. We celebrate the people, the businesses, the diverse culture that Manchester represents. The investment we have made in southern New Hampshire through the expansion of this facility is bringing the highest quality healthcare to the community, and along with it, jobs, new families, new faces, to further enrich an already rich and diverse community. Together we can achieve the Dartmouth-Hitchcock Health vision to achieve the healthiest population possible, to lead the transformation of healthcare of our region, and to set a standard that can be admired nationally. Thank you very much.
Thank you, Ed. We are so proud to be part of the fabric of this community. To that point, I'd like to now introduce Dr. Maria Padin. Maria is the Chief Medical Officer of the Southern DH Region Community Group Practice. Her connection to Manchester, and in fact, the whole Southern region, runs very deep as a practicing OBGYN in Southern New Hampshire for a number of years. We are incredibly fortunate to have her leading our work in the Southern region. Maria.
Thank you, Joanne. It's wonderful to be here, and I have to say, in person. For many of us, it certainly may be the first time that we get to see each other. It certainly has been a year to remember. This grand opening is a celebration of a long imagined goal. Our goal to care for people we serve in an environment that optimizes the strength of a community group practice that is anchored with an academic medical center, as Joanne alluded to previously. These strengths include a better integration and coordination of our clinical services and convenience for our patients and more effective, efficient collaboration with our provider teams to deliver care. The 91,000 square foot expansion includes a state-of-the-art ambulatory surgical center with 6 operating rooms and the ability to care for our patients for up to 23 hours. We are thrilled to now be able to deliver on-site, high-quality, and cost-effective ambulatory surgical services, which is important not only to our patients, their families, but also our communities. These services are value-driven and feature our commitment to non-hospital-based billing to keep costs low. We talk a lot at Dartmouth about the value proposition, which is great care at a price that is affordable for our communities. We have dedicated also pediatric pre- and post-operative rooms to care for our youngest patients in a warm and comforting environment. The second floor of our building, which some of you will have the opportunity to tour today, also includes our commitment to expanding our specialty services in general surgery and gastroenterology, musculoskeletal services, including orthopedics and podiatry. And this expansion also now allows us the opportunity to retrofit some of our other space to really continue to add additional new services and technologies, including a fixed MRI. Our commitment to creating patient-centered comprehensive care right here means easier access, great care for the community with expanded primary care and urgent care visits. Our mission has not changed. We care for our patients in the communities regardless of their ability to pay. As we know that we just can't care for patients within our walls, we will continue to be collaborators with our community partners to continue to address those social determinants as well that are so interconnected to the well-being of our community. We are so excited that this project is completed and that the vision that we had, ushered many ways by Steve, has become a reality. Easy access to world-class healthcare right here in your neighborhood. I am thrilled to be a part of it. There's no small feat to accomplishing this task. And actually, when we opened our medical office building, we had almost on the first week of really full schedule while we were still working on the ambulatory surgical center. It takes always a village, and we are grateful for that village, many of you who are here today. Thank you to each and every one of you who touched the project. Craig and I are forever grateful to your dedication. Back to you, Joanne.
Thank you, Maria. So this is the individual participation part of the program, I'm going to invite all of you to join me over by the north entrance of the building, where Mike Skelton, the executive director of the Manchester Chamber, is going to help out with the fun part of today's celebration, the official ribbon cutting. So if you could follow us over there, and we'll officially anoint the building.
All right, good afternoon, everyone. I'm Mike Skelton, the CEO of the Greater Manchester Chamber. On behalf of the business community, really want to congratulate Dr. Conroy and the entire team on this amazing accomplishment. Like everyone else has already said today, I am thrilled to be here in person at a ribbon cutting, something we at the Chamber do on an almost daily basis during normal times. So it's so exciting to have you guys kick back off that tradition for us with this amazing contribution. After the last year, I think we have learned that investing in the health of our community is investing in our prosperity. And at the Chamber and the business community, that's something we really take to heart and is essential to our mission. So thank you so much for all that you're doing here. And congratulations to Dartmouth-Hitchcock Health. Dr. Conroy, do the honors.